of the world to mark the 2024 Universal Health Coverage Day, there could not have been a more apt theme, health. It is on the government. In Nigeria today, hundreds of thousands of citizens die on account of lack of access to quality health care, which a functional health insurance scheme could have guaranteed at all levels. On 12 December 2012, the United Nations General Assembly endorsed a resolution urging countries to accelerate progress toward universal health coverage. The idea that everyone, everywhere, should have access to quality, affordable health care. On 12 December 2017, the United Nations proclaimed 12 December as International Universal Health Coverage Day. By resolution, International Universal Health Coverage Day aims to raise awareness of the need for strong and resilient health systems and universal health coverage with multi-stakeholder partners. Each year on 12 December, UHC advocates raise their voices to share the stories of the millions of people still waiting for health, champion what we have achieved so far, call on leaders to make bigger and smarter investments in health, and encourage diverse groups to make commitments to help move the world closer to UHC by 2030. With me in the studio, I have a special guest who will be discussing this sensitive topic with me today. Good afternoon to you, Dr. Babagana Adam.
Good afternoon.
Dr. Babagana Adam is a permanent secretary, Health Services and Environment Secretariat, and he will be joining me in live to discuss this sensitive topic today. Once again, good afternoon to you, Dr. Babagana Adam, and thank you for joining us on this program.
Good afternoon, and have a nice day and a wonderful station. Nice to be here.
I'll start by congratulating us on this year's Universal Health Day celebration.
Thank you very much. I think we should all be congratulated. We celebrated it yesterday here in the FCT.
Okay. So I will ask, I myself and other Nigerians were curious to know the significance of this year's theme, health. It is on the government. What is the significance of this thing?
Yeah, the significance is that government should provide all the necessary ingredients that will bring health to the people, so that people can access health and no one is left behind. So that at the end of the day, the services that are our respective hospitals, people can have access to it. Rich, poor, the vulnerable, the weak, the strong, male, female, so that there won't be any gap for somebody to be wanting to. So it is the responsibility of government to put whatever that is necessary, so that at the end of the day, services can be reached by the people easily, without any financial constraints, without any challenges, through our health insurance system. As you know, it's a multifaceted thing. Having the facility, having access to the facility, having the medical personnel and all other people. So that is the responsibility of government.
So I want to ask, Nigeria as a country, where are we as far as this universal health coverage is concerned?
As far as Nigeria is concerned, we are doing very well, because states like Delta, the FCT, Lagos, and a key of other states have been doing well, because you know, under this administration, the focus on basic healthcare provision has been set as an agenda, and there is this renewed health agenda under the renewed hope agenda of Mr. President Bola Ahmed Tinubu. It has set a course to ensure that health reaches all, and that's the universal health coverage. So for FCT, we are unfortunately second to Delta in terms of the target reach.
Okay.
We have been given a target of 25,000 for the next 4 years, so that we can reach 200,000 enrollees. That's those who are to be put on insurance scheme. So FCT achieved from January 2024 to November, we have achieved 36,000. So we have hit our target beyond by 11,000. So that's interesting, and that's very encouraging. So we are optimally also doing the best possible we can to enroll people. And like I told you, we have already enrolled over 36,000, above the target of 25,000 that is given to us per annum. So what we have been able to achieve is a milestone that we are not only looking for those who can afford to pay, we are also looking at the indigents, those who cannot pay.
Yes,
and then we get philanthropists, government, including government, to pay for their premium, which is just 13,500. When you pay 13,500 per annum, you get the services in our hospitals for your drugs and all other things that are necessary under the insurance scheme. You know, we have, apart from the National Health Insurance Authority of Nigeria, we have the FCT Health Insurance Scheme.
Yes, I'm coming to the FCT. Talking about FCT, what are the initiatives taken by the FCT Health Insurance Coverage Scheme to capture all the residents of the FCT?
Like you saw yesterday, we had a walk from the Eagle Square to the Area 11 office of the Honorable Minister, where I received them on behalf of the Mandate Secretary, Dr. Adedolapo Fashawe. So I received them there to get the charge on what needs to be done. And what we are doing, we are sensitizing, because people cannot take what they don't know.
Yes.
So first and foremost, public enlightenment, just like we are talking about it now, is very important. When people get to know that we have this insurance coverage for all at the rate of 13,500, and some that cannot afford, there are some charity organizations, some philanthropists that are paying for those premiums.
Yes.
And we also, outside the public sector, we also get other people who are also championing and marketing at marketplaces, motor parks, at maybe some other informal settings to get them enrolled. And once they enroll, I think from the primary healthcare level up to our secondary facilities, every other charges that you may pay at the hospital is just 10%. And if you cannot afford it, it's free, because government has done a special fund where 2% of the consolidated revenue fund is kept to pay for those bills to help people that cannot afford. Because, and that is why it is the responsibility of government, just like security, for people to have access to health. And that is why we call it universal health coverage.
Okay, so like it has been on my mind to ask you, how affordable would this scheme be? But now that you've answered the question in your previous answers, so I would love to ask, how accessible? You know, it's not okay for it to only be affordable. Yeah, we can pay it. It's affordable for us. How accessible is this scheme for these people?
Access means a lot. Affordability in itself is access.
Yes.
So we have brought schemes that you can even pay installmentally. You can pay on a monthly basis, so you can break down what you can afford to pay. Maybe month one, you can pay 1,300. In 10 months, it's already 13,000. So even if you are a motorbike or a cab driver or just a small petite trader, you can decide to cascade what you will pay. And once we have that commitment and it's registered and you are paying, we register you. The other thing is, you know, if any pregnant woman in a rural setting, you know, in FCT we have the free antenatal care and the free under 5. Under 5 means any child that is below the age of 5 at our hospitals, when they come, treatment is free. It's almost free because you have to bring yourself. So it is not really free because you have to bring yourself.
But how do the mothers of these children assess? You know, some hospitals, when you go there, they might tell you, wait, like you keep waiting till maybe your child is at the breath of death. How do these mothers assess this scheme? That's
well, at our hospitals, we are concerned about every patient that steps in, and that's why we have the Servicom decks, and we have the health insurance decks, and we have CCTV cameras at each of our hospitals. So for anything that is happening at the hospital is on our fingertips, and we see what's going on. But first and foremost, you know, when you come, even to this station as I came in, I had to clock and register. So there are processes of taking demographics. Who is your name? What are you coming from? Except if it is an emergency.
Yes.
If it is an emergency, we jettison all these checks and we do them. So pregnant woman from the village that you are asking for, the first port of call is not Asokoro Hospital or Kuje Hospital. It has to be the primary healthcare center. So once you come through the primary healthcare center, there is a stage of your condition that will demand you being attended to, or you will be referred to the secondary facility. So once you pass through the primary healthcare center, if you come to our secondary facility, it's free. But when you come direct and you bypass the primary healthcare center, then you have to follow the charges that are at the primary healthcare facility. This is for us to encourage people to stop at the primary healthcare center so that our hospitals are not congested. You know, for headache and other menial issues,
yeah.
the primary healthcare center, a nurse, a pharmacist technician can attend to you, give you maybe any other drug that can solve it.
So our primary healthcare centers are equipped with all
yes,
this?
they are equipped in every ward in FCT. In FCT, we have about 261 primary healthcare centers. Then out of these 261, we have upgraded the standard of 62. And as you are aware, FCT has 62 wards. AMAC has 12 wards. Then the other 5 area councils have 10 wards. So when you sum it up, it's 62. So at a distance of about 30 minutes, you can reach any of our primary healthcare centers. So, and they are fully equipped and they get funding from the federal government as well as the FCT, so that they can route their hospitals or their primary healthcare centers. The doctors, the midwives, the nurses, the pharmacy technicians are all paid by the local government, state, and the federal government, and some stipends are given to them so that they can provide universal health coverage for all.
Okay, so as we round up, you know, Nigeria as a country, the health sector is doing amazingly well. I commend you for that.
Thank you very much.
You're welcome. The experiences, we cannot forget about the history and our experiences. The biggest challenge in Nigeria, as we all know, is fake drugs. Fake drug. What is the scheme doing about it?
Well, for us, you know, there's an institution set up. First and foremost, I would like to use this opportunity to wish my Honorable Minister, Chief Nyeson Wike, that is doing everything possible for us at the Health Services and Environment Secretariat to work. Wish him a very happy birthday. Today is his birthday. And I can tell you the good news that Mr. Minister is doing is not only providing infrastructure, physical, he is also providing the human infrastructure. He has cleared all the payments to HMOs, you know, the medical operators that connect between our FCT health insurance and the hospitals. So we have cleared all. In fact, we have even started the process of paying for January, February, March. So our system has been going ahead, and Mr. Minister is not only taking care of roads, bridges, and physical things that you see. He has been up and doing, and he has approved over 3 billion naira for all this scheme, positive scheme of health insurance to be paid. Because once these insurance are paid, you know, the hospitals can now offer services. And what you say that used to happen in the past,
yes,
I think since he's coming, it's not happening because the HMOs are paying, FCT is paying the HMOs, and the HMOs are paying the facilities, and things are done in the proper direction. So I would like to use this opportunity to wish him a very happy birthday, and also congratulate your media outfit for doing what you are doing, and you are doing an excellent job. Whichever way we can encourage you, we are always available.
Thank you very much, Dr. Babagana Adam.
Thank you very much, the anchor and the station.
And there has been Dr. Babagana Adam, a permanent secretary, Health Services and Environment Secretariat. We've been able to dissect the health sector of Nigeria, and as it has been well said, the Nigeria government is taking a very bold step to give the best insurance to its citizens. Thank you for joining us on today's program. My name is Amina Idris for Politics and Business Television, Abuja. Bye for now.